Hello, everyone, and welcome to this month's Viewpoint. And as you see here is a picture of Reynolds Pharmacy, the pharmacy that my parents built and opened in November of 1973. And we served the patients of McLeansboro and Hamilton County faithfully for almost 30 years until July of 2002. I'm real proud of what my parents were able to do. The passion and drive that we had for running that business, and it was a family business. We all worked in there. My grandparents, to my sister and myself, and my mom and my dad, and our technicians, they were family. We served the citizens of McLeansboro and Hamilton County with their pharmacy needs, their family needs, and their community needs. And we did everything we could, and probably things more than what we probably should, whenever it came to making sure that patients had access to their medications. And we know it's the same things that you do each and every day. And whenever we are making sure that patients have medication, whenever we know that it's hurting us financially, but to make sure that patients still get the medication because that mail order script still didn't come in for the third month in a row, and it was delayed again. The patient is off their treatment plan because the mail order still cannot get it right. Or making sure that a patient has needed medication because of the erected barriers from a prior authorization that is now on its third week of being able to get approved, and the patient has gone without their medication, but yet we are making sure they still have access to that med. It infuriates me when I see PCMA and their pathetic excuse for a public relations campaign telling our patients that they need to stand up to independent pharmacy because we're the ones erecting barriers, that we're the ones raising costs. It's difficult to describe the fury that comes up and boils up because pharmacists are always in the community. We have been there. This past year alone in 2020, when pharmacies never closed, when pharmacies remained open, pharmacies changed their practice to make sure that patients could still get their medication safely. We put ourselves on the line in danger with a deadly virus, and the PBMs have the audacity to say that we're the problem when they create the barriers. They did next to nothing during this pandemic to help patients. Only when it came to public shaming did they start to release the abusive audits. But they did for a short time. What they do, they come back and they've doubled and almost tripled the amount of audits. It's amazing the despicable audacity that we continue to see from PCMA and their members. They talk about in their campaigns, they want to negotiate for lower costs. Great. Let's actually use the term that's in the definition in the dictionary and understand what that word really means. Because pharmacists have always been willing to work and always work to find the most cost-effective way. And we don't play the games of rebates and manipulating pharma to come to play to pay to have access to patients. We're there to serve because we're the healthcare providers, not the credit card fee processor in between. We have to stand up. We have to continue to push for legislation like Senate Bill 2008 and House Bill 3630. Senate Bill 2008, our PBM reform bill for this year, will help Illinois citizens have better access to pharmacists, better access to their medications, and better access to patient care services. The Supreme Court has stated that the states have the right to regulate PBMs and prescription benefits. So we must take this step forward, not only for our practices, not only for ourselves as healthcare providers and the right to serve our patients, but to ensure that our patients have the best chance for the best health outcomes possible. If we continue PBMs to continue to erect the barriers, continue to spew this pitiful rhetoric, patients will continue to suffer. Our healthcare system has not been as open as it should be for everyone in all of our communities. We have continued to see pharmacy deserts pop up. And if it wasn't that there's still one pharmacy in Hamilton County and McLeansboro, there'd be an entire pharmacy desert for the citizens of Hamilton County and of McLeansboro. And that's one pharmacy for that entire county. We really need to be looking at how we process healthcare and stop worrying about stockholder prices. We're here as healthcare providers. PBMs need to get out of the way and allow us to take care of our patients. I hope everyone has a good rest of their weekend. As we're recording this, it's Easter weekend. So happy Passover from last weekend and happy Easter to this weekend and Orthodox Easter the following weekend. I want to remind everyone that we have Legislative Day coming up on the 21st. Registration's free this year. So everyone is expected. This is a year to stand up for our patients and for the profession.